Hi everyone, welcome to week 4. I'm Dr. Pauline Stolzner. This week we're going to be focusing on ethics in nursing and ethical dilemmas. As nurses, we navigate decisions that are both ethical and legal, but those two aren't always the same. Ethics is about what's right, law is about what's required. In complex clinical situations, our job is to honor both while advocating for our patients. So how do we know what's ethically right? That's where the ANA Code of Ethics comes in. The ANA Code of Ethics has 9 provisions that guide our moral responsibility as nurses. It emphasizes things like protecting patient rights, practicing with integrity, and reducing health disparities. Provision 8 specifically reminds us that nurses must collaborate to protect human rights and promote health equity. Have you ever leaned on the Code of Ethics to guide a tough decision? There are 4 foundational ethical principles in nursing: autonomy, honoring patient choices; beneficence, doing good; non-maleficence, doing no harm; justice, treating people fairly. These principles often compete, and navigating that is the art of ethical nursing. Let's look at some examples where those values get challenged. You might face dilemmas like a patient refusing treatment that could save their life, or a family demanding interventions that go against a DNR. Or maybe you're unsure how to advocate for an undocumented patient needing surgery. These situations don't have right answers, but they do demand thoughtful reflection. Which of these dilemmas have you seen or experienced? Sometimes what's legal doesn't feel ethical, like discharging a patient who has nowhere safe to go. And sometimes what feels ethical, like giving undocumented patients free meds, might have legal gray areas. When in doubt, consult with ethics committees, supervisors, and review policies. You're not alone in those decisions. These decisions also take a toll on nurses emotionally. Moral distress happens when you know what feels right, but can't act on it due to institutional barriers. It's a major contributor to burnout and compassion fatigue. Creating space to talk about ethical tensions is crucial for our well-being and patient safety. How do you process moral distress when it comes up in practice? Use a structured process when facing ethical dilemmas. Identify the issue, gather facts and perspectives, consider the ethical principles involved, consult guidelines or codes, act and evaluate the outcome. These steps give us confidence and accountability. Let's apply this to a real case. Imagine this: a patient has a DNR order, but the family demands full code if the patient crashes. What ethical principles are at play? Who has decision-making authority? Your role is to advocate for the patient's wishes while communicating clearly and compassionately with the family. How would you respond in that situation? What values guide your nursing practice? How do you handle ethical conflict or gray areas? Who or what helps you make these hard decisions? And finally, how can we support each other better when ethical dilemmas arise? Ethics is not about perfection. It's about presence. Be grounded in your values, curious in your questioning, and courageous in your advocacy.